The first application that I would like to bring your attention to is NurseTabs MedSurg. NurseTabs MedSurg is separated by body systems so that nursing students could quickly and easily obtain many common medical diagnoses when they're going over those subjects within their nursing courses. Essentially, if I were to press on any of the body systems, I will be able to find medical diagnoses related to that system. For instance, cardiac. You can see here that you can scroll down. You could also just click on the letter of the diagnosis that you would like to look up, and it will directly go to that letter. In addition, you can go back and search for any diagnosis by going to the All tab. So essentially, if I were to look under heart failure, it gives me a couple of different options, and it depends on the way your school teaches heart failure. But congestive heart failure, left-sided heart failure, right-sided heart failure are the options that came up. So we'll go ahead and click on congestive heart failure. What I like about this is that it does separate, just in case you're looking for quick, easy information related to congestive heart failure, or if you're looking for common assessment findings related to it, typical complications that we might be watching for with a patient that has congestive heart failure, and then nursing diagnoses that might apply to a patient with congestive heart failure. Certainly one of the most important things we do in nursing is we try to implement a care plan for our patients, and it must be client-centered, and for that we would look under client-centered goals. And then, of course, how are we as nurses going to make sure that the client meets those goals and objectives, and that would be through our interventions. So if I click on All, you can see here that I have the About, and it is just a general statement related to my practice as a nurse and my practice as a nursing professor. In addition, it has common assessment findings and potentially what a nursing student should be assessing for with a client that has heart failure. One of the parts of the nursing process is to constantly evaluate our patients. Certainly we have to evaluate whether they meet their goals, but also we want to continuously be evaluating to make sure that they do not have complications relating to their medical diagnosis. Nursing diagnosis statements or problem statements are a way to focus our care plan. And certainly we would have to individualize this for the client that we are caring for. But here in this application, we have some sample nursing diagnoses that might apply to a patient that has congestive heart failure. If we scroll down, we have client-centered goals. Client-centered goals are necessary to direct the care that we give our patients. And then, of course, finally, the interventions that we do for our clients with congestive heart failure. General interventions, and certainly a nursing student could add more based on their individual client needs and assessment findings. One of the most important things with interventions is to consistently be monitoring and assessing our patients. So you will find that the monitoring and assessments are always first for the interventions, as that is first in the ADPI, assessment, diagnosis, planning, intervention, and evaluation that we use as the nursing care plan. Certainly I have put in sample drugs that we might give for a client, so administer diuretics as ordered, and that would be based on what the physician orders. Certainly other cardiac drugs that might be used for a person with congestive heart failure includes cardiac glycosides, which would be your digoxin, antihypertensives and nitrates, depending on if they have chest pain or high blood pressure or other needs related to the antihypertensives. And as you scroll down here, you will see that there is consistently going to be an intervention to monitor for signs and symptoms of complications so that we're continuously evaluating our client. Essentially, you can get back to the home page just by going to the Home button. You can see that there are several body systems here. We even have reproductive, limited as it is, but related to medical surgical diagnoses that men and women do have. Respiratory, immunologic, musculoskeletal, hepatobiliary, neurologic, integumentary, hematologic, gastrointestinal, fluid and electrolytes, cardiac, and endocrine. And certainly if you just want to look up a diagnosis, you could go to the All button. The overall goal of NurseTabs MedSurg is to provide a quick and easy tool for students to navigate through, whether they be in clinical or in the didactic teaching setting. The goal of this application is not to replace the textbooks that students are currently using, nor is it meant to replace the teachings that we as professors provide for our students. The goal of this application is to provide an engaging application for students to use to supplement the learning that they're already undergoing in the classroom and in clinical.